Treat canine diabetes. Canine diabetes has three basic forms, namely, canine gestational diabetes, diabetes insipidus, and diabetes mellitus. Among them, diabetes mellitus is the most common. Canine diabetes is generally characterized by a disorder in insulin production. Some dogs that are afflicted by it suffer from deficiency in insulin. Other dogs turn out to be insensitive to it. When the pancreas produces insulin, the glucose blood concentration is readily regulated. When canine diabetes gets worse, common symptoms progress, too. Dogs with canine diabetes are going to urinate excessively. As a result, they are going to experience extreme thirst. They are also going to lose weight. That's attributed to the breakdown of stored muscle and fat. And soon after, they are going to be lethargic. They are going to lose their interest on things. The advanced and more serious stage inevitably triggers anorexia, dehydration, and infection. Cataracts also begin to debilitate the eyes of the dogs. Here are some measures on how you can treat canine diabetes. Realize that some breeds and bloodlines are more prone or susceptible to canine diabetes. Discuss the issue with your veterinarian. If your dog is more likely to acquire canine diabetes, ask for the appropriate steps to be taken. By noting the risk factors, you can literally save your favorite pet's precious life. Promptly consult a veterinarian when symptoms become apparent. Don't take chances. Let the veterinarian assess the condition of your dog. He can physically examine your dog and closely observe it. If symptoms persist, he can recommend suitable laboratory tests. He can measure your dog's blood sugar levels. He can also determine the glucose in its urine. Follow your veterinarian's orders to the T. Your veterinarian may recommend insulin injections. So, stick to it. Staying on schedule is really important. You should inject it to your dog once or 2 times a day. Your veterinarian has to set the required dosage. Don't deviate from the prescribed dosage. The insulin dosage isn't just based on your dog's actual weight. It also factors in a number of aspects, including the severity of your dog's health condition. You may also be instructed to test your dog's urine using glucose test strips and monitor its blood glucose levels. See to it that records are kept, indicating the injections and corresponding the levels. Feed your dog according to the suggested diet. Your veterinarian should be able to remind you about your dog's strict diet. The diet is going to play a critical role in controlling the disorder. Your veterinarian may recommend a diet that is high in protein and fiber but low in carbohydrate and fat. Again, you have to follow the feeding schedule. Your dog needs to eat on time, every day. Your veterinarian is going to set your dog's feeding time. By sticking to the above measures, you can certainly help your dog to get better soon. Bear in mind that your dog's feeding time should be done simultaneously with its injection. It is always safe to let your dog eat first and after 20 or 30 minutes, you can give its injection.